Hello everyone and welcome to another video on ECG. In today's video we are going to discuss the basic steps in interpretation of an ECG. First of all, let me introduce myself. I am Dr. Wajid Shabir. I have done residency in cardiology and currently I am working as a registrar cardiology. If you are a medical professional and you are interested in learning ECG, you must subscribe to our YouTube channel as well as like our Facebook page with the name of Two Dogs. So let's begin the discussion on ECG basics. The first thing which we will look at is the rate. For accurate calculation of heart rate, we must first know the standardized ECG. A standardized ECG should have a speed of 25 millimeter per second. One small square on an ECG paper is equal to 40 millisecond or 0.04 second. Similarly, one large square which includes 5 small square is equal to 200 millisecond or 0.2 second. Now, this is a standard ECG paper which shows speed on horizontal axis, rather time on horizontal axis, while voltage on vertical axis. As I told you that one small square is equal to 40 millisecond or 0.04 second. Similarly, one large square consists of 1, 2, 3, 4 and 5 small square which is equal to 200 millisecond or zero point 0.2 second. Now 5 large squares they are equal to 1 second. When we look at the voltage on vertical axis, we can see that 10 millimeter or 2 large squares are equal to 1 millivolt. Now, what are the methods to calculate heart rate? There are multiple methods to calculate the heart rate. First is we can calculate the heart rate by dividing 1500 by number of small squares between two R waves. Also, we can get the heart rate by dividing 300 with the number of large squares between two R waves. Also, there is a crude method for calculation of heart rate, especially in emergency situations, in which we select a QRS complex which lies on broad vertical line, and between that QRS complex and next QRS complex, we calculate the large boxes at 300, 150, 175, and so on. Whenever we get a ECG on which the heart rate and rhythm appears to be regular and within normal limits, in that case we use this formula in which we divide 300 by number of large squares between two consecutive R waves. While in case of fast rhythms, we use 1500 divided by number of small squares between two consecutive R waves to calculate the heart rate. Here in this diagram, we will learn how to calculate the heart rate. In the upper portion of the diagram, we will use the formula 300 divided by large squares between two RR interval. For example, if you see here, between these two these two R waves, there is one large square. So 300 divided by 1 will be equal to 300 beats per minute. And the heart rate between these two hour interval will be will be 300 divided by number of large squares, which is 1 and 2. So 300 divided by 2 will be equal to 150. Next, when there are three large squares between two RR intervals, the heart rate will be 300 divided by 3 and it will be 100 beats per minute. When you get four large boxes between two RR intervals, the heart rate will be 300 divided by 4 and it will be equal to 75. And in case of five large squares, the rate will be 300 divided by 5 is equal to 60. In a crude method which I told you, we will select a QRS complex which lies on broad vertical line, and then between this QRS complex and next QRS complex we count large boxes. As first large box is calculated as 300, next as 150, and the next one as 100, and then 75. While in upper portion of the picture we used formula 300 divided by number of large squares between two R waves, in lower portion we will practice the formula 1500 divided by number of small squares between two R waves. For example, here you can see that between these two R waves, we can see that the number of small scale is 1, 2, 3, 4 and 5. 1500 divided by 5 will be equal to 300 beats per minute. While between these two R waves, there are 1, 2, 3, 4, 5 and up to 10 small scales. 1500 divided by 10 will be equal to 150. Hopefully after this exercise you will be able to calculate heart rate quite easily on an ECG strip. Another important thing which you should remember that in some cases like heart block there is difference between the atrial rate and ventricular rates. So in those cases we must calculate atrial and ventricular rate separately. Usually, the recording machine also gives the heart rate at the top of the ECG, but it should not be relied on completely because this finding may be false due to our sensing of machine or under sensing. Now, the normal heart rates in children and adults are different. In newborns, a heart rate of 110 to 120 beats is considered normal, while up to 2 years a heart rate of 85 to 125 is normal, and in children from 2 to 4 years of age a heart rate of 75 to 115 beats is normal, and children who are 6 years or above they have a heart rate range which is similar to adult population. In adults, the normal heart rate is between 60 to 100 beats per minute. And if it is more than 100 beats per minute, it is known as tachycardia. A heart rate which is less than 60 beats per minute is called bradycardia. Now we will move on to the next step, which is the rhythm. The rhythm is best analyzed by looking at the rhythm strip, which is usually a long lead at the bottom of the ECG. And whenever you find an abnormal finding on rhythm strip, you must uh, compare it with other leads on ECG. Now, for assessing a normal or abnormal rhythm, there is a certain approach you should use on ECG. Here are 7 important steps which you should consider while assessing rhythm on an ECG. Now, firstly, whenever you look for rhythm on an ECG, first thing which gives a clue to normal or abnormal rhythm is rate. If you find a bradycardia or tachycardia on an ECG, you must look for any abnormality of the rhythm. Now, the next thing is the pattern of QRS complexes. You must ascertain that whether the QRS complexes are regular or irregular. And if they are irregular, you should look for regularly irregular or irregularly irregular QRS pattern. Also, QRS morphology is important because in case of tachycardia, if there is a narrow complex tachycardia, it means that the tachycardia is of supraventricular origin. While in case of wide complex wide complex tachycardia, uh, tachycardia could be of ventricular origin, or it might be due to some supraventricular rhythm with aberrant conduction. Now, the fourth step in assessing the rhythm is to look for P waves, whether P waves are absent or present. An absence of P waves mean that there is either sinus arrest or atrial fibrillation. And if P waves are present, we should look for morphology and the PR interval, which may suggest the sinus atrial junction or even retrograde origin of P wave. Now, another thing is the relationship between P waves and QRS complex. If there is AV dissociation, which may be complete or incomplete, it can indicate that there may be underlying heart block or ventricular tachycardia. Also, if there is tachycardia, we must look for the onset and termination of tachycardia. And a tachycardia which is of rapid onset and termination is likely due to reentrant mechanism. Now the last is what is the response of the tachycardia to vagal maneuver. So the tachycardia which slows down with vagal maneuvers, but they again restart on stopping the vagal maneuver, most likely represents sinus tachycardia, ectopic atrial tachyarrhythmia. While the arrhythmias which spontaneously terminate with vagal maneuvers usually reflect supraventricular tachycardia. In case of atrial flutter and atrial fibrillation, there might be transient slowing of the heart rate, but with stopping the maneuver, there will be again increased rate of ventricular. While vagal maneuvers do not have any effect on ventricular tachycardia, this is because there is no autonomic supply of, heart below the AV node. So after the rhythm, the next step is determination of axis. There are multiple methods to determine an axis on ECG, but an easy method is quadrant method. To estimate the axis on an ECG, we should look for the direction of QRS complex on lead 1 and lead area. So if you want to know the axis on an ECG, you must remember this table. If you look at the lead one and you find a positive QRS complex and there is a negative and there is positive QRS complex in lead AVF, it means that the axis of the heart lies between 0 degree and 90 degree and it is a normal axis. While in case of positive QRS complex in lead 1 with a negative QRS in lead AVF means that axis lies between 0 to minus 19 and it is actually a possible left axis deviation. On an ECG with negative QRS complex in lead 1 and positive AVF means that the axis lies between plus 90 to 180 degree, which is right axis deviation. A negative QRS complex in both lead 1 and lead AVF means an axis lying between 180 to minus 90, which is an extreme right axis deviation. Now, here are some examples to find the axis. If you look at the direction of QRS complex in lead 1, it is positive. Similarly, the QRS complex is positive in lead AVN, which means that the presence of both positive QRS complex in lead 1 and AVN means that this is our normal axis. Now in this ECG, you can see that the direction of QRS complex in lead 1 is negative, while the QRS complex is positive in lead AVN. So positive QRS in lead AVF or negative QRS in lead A1 means that this is our right axis deviation. Here you can see that the QRS complex is positive in lead 1 and negative in AVF, which means that the axis lies between 0 and minus 90 and it is our left axis deviation. In this case, the QRS is negative in lead 1 along also it is negative in lead AVF, meaning that the axis lies between minus 90 and 180, which is an extreme right axis deviation. Now, whenever you are interpreting an ECG, you must remember or keep in mind the rule of force. You should look for four initial features, four waves, and four intervals. Now we will study them one by one. First is four initial features on an ECG. The first and most important is history and clinical picture. We must remember that like any other test, ECG is another test and it should be interpreted with complete clinical scenario. We must know the name, age, time, and symptoms along with other clinical features. Before starting the calculation of rate or rhythm, we must first check for accurate placement of leads. One quick method is to check for lead AVR whether there is upside down P wave QRS complex and T waves in lead AVR with an opposite P QRS and T waves in lead AVL, which means that it is a normal lead placement. Also, you should look for chest leads and you should look for R wave progression across the chest leads. Now, the second of initial four features is rate. As I told you, the normal rate is 60 to 100 per minute, and a rate lower than this is bradycardia, and more than this is tachycardia. Next is rhythm. We should look for presence of sinus rhythm or any abnormal rhythm. The fourth initial feature is axis, whether it is a normal axis, it is a left axis deviation, right axis deviation, or right axis deviation. After that, we have four waves on an ECG. Four waves are four complexes on an ECG. First is the P wave, which represents the atrial depolarization. It is best localized in lead 2. We should look for P wave morphology, particularly the presence of a P pulmonale or P mitral. Next is QRS complexes. We should look for the presence of Q waves in or limb leads or chest leads. Similarly, the amplitude and progression of QRS complex should be looked for along with the duration of QRS complex. Third is T waves. T wave inversions or T wave flattening can denote the presence of ischemia. Also, we should look for any presence of U waves which denote presence of hypokalemia. Now, this is a graph which shows the different waves and intervals. First is the P wave, then there is Q, R, and S complex, then there is ST segment. and the point at the junction, the point where QRS complex meets the ST segment is known as J point. After that there is T waves and sometimes there may be presence of U wave. Now looking at the intervals, the first is PR interval. It is from the beginning of P wave till the beginning of QRS complex. Next is the duration of QRS complex. It is from the beginning of Q waves till the end of S wave. Next is the ST segment, which is from the end of S wave to the beginning of T wave. After that is ST interval. It is from the end of the ST segment till the end of T wave. Also there is a TP interval, which is from the end of T waves towards the beginning of P wave. Another important interval is QT interval. It is from the beginning of P wave till the end of T wave. Now we will look at these intervals. Four important intervals which should we look for on an ECG. First is the PR interval. The normal PR interval is less than 5 small squares or 200 milliseconds. A prolonged PR interval or PR interval which is changing its length indicates an heart block. Similarly, a PR interval which is less than 3 small squares or 120 milliseconds, uh, along with the presence of initial slurred portion of QRS complex, indicates presence of WPW syndrome. Now the QRS width or QRS interval. The QRS is normally less than 120 millisecond or 3 small squares. A QRS complex which is more than 3 small squares or 120 millisecond indicates conduction defects between the ventricle. Could be right bundle branch block, left bundle branch block, or even fascicular blocks. Now another important segment of the ECG is ST segment. It is from the end of S wave to the beginning of T wave. It is the most sensitive part of ECG to ischemia. Now you should look for presence of any elevation of ST segment, downsloping depression of ST segments, or flattened depression of ST segment. And you should look carefully for any changes in ST segment. Now the last is QT interval, which is from the beginning of Q waves till the end of T wave. The normal QT interval is less than 440 milliseconds in male patients and less than 330 milliseconds in female. So this was all about the basics of ECG. Hopefully you learned from this video, and for more videos kindly subscribe to our channel and like our page on Facebook, and till then Allah Hafiz and stay tuned.